So we're going to start by talking about genetic testing. This is a pie chart that looks at data from two clinical trials run by the Gynecologic Oncology Group, GOG 218 and 262, and these were for patients with advanced ovarian cancer. And the reason this is important information is because it wasn't based, the information here isn't based on people who were very young when they were diagnosed or had a strong family history. It's really saying, you know, the general overall population of ovarian cancer, what do we see when we do genetic testing? And what you see here is in purple, the vast majority of patients in this study, 81% were wild type, which meant they had no identified germline mutations. What you can see in the blue, orange, and green parts of the pie chart is that about 19% of patients did have some mutation. Most of these in the blue and the orange were BRCA mutations, either BRCA1 or BRCA2. There's another 5% that's one of a whole number of different genes, some of which may be, yes, I have this gene, but it didn't cause my ovarian cancer, or it increases the risk of ovarian cancer only very slightly. And these are the ones that we've learned a lot more about over the last few years. This is a little bit of a complicated chart, but what it lists on the left are some of the genes that have been identified in these gene panels. And then in the fourth column over where it says SRR, that's standardized risk ratio, it means if you have this gene, what compared to a person without that gene, what is your risk of ovarian cancer? So you can see in the first line with an ATM mutation that your risk of ovarian cancer is 2.25, someone without that. The general population risk in the United States is 1 to 2%, so that means if you have an ATM mutation, your risk is probably somewhere around 4 to 5%. You can go down a couple of lines and see for BRCA1 that it's about 12 times the general population. So we're now getting up to much higher risks of ovarian cancer. You can also see some on here. So, for example, CHEK2, which is about number 6 on the list. The standardized risk ratio is 0.98. That's essentially 1, which means that the risk of having ovarian cancer is about equivalent whether you have this mutation or you don't, and therefore that's not one that we consider the one that increases the risk of ovarian cancer. I see on the right that we have a question about the MSH2 mutation, and what you can see here is a very high risk for people with MSH2 mutations. The issue here is that there's very small numbers, but that is one of the Lynch genes, and we'll talk about that a little bit at the end when we talk about immunotherapy. So if we look at the different types of histology of ovarian cancer, everybody said, well, it's the high-grade serous that are really the ones that are genetic, but what you can see here is that high-grade, grade 2 and 3 serous is on the top bar, and you can see there that it's about 22% of those will have some type of mutation, BRCA1, BRCA2, or other. But the adenocarcinomas that aren't serous also have a mutation. The grade 1 serous or low-grade serous might have a much lower risk, but they still can have a mutation. The endometrioids and the clear cells also have mutations. So there's no histology in ovarian cancer that sort of gets out of a concern for there being a gene mutation that could potentially put people at risk. If we look at this sort of a graph, which is using a female figure for risk, this is looking at all high-grade serous ovarian cancer. Each of these figures represents 10% of patients. And so what you can see on the left in the green is that about 15%, so 1.5 of the little dolls, will have a germline BRCA1 or 2 mutation. We saw that from the pie chart. And then in orange, another 10%, which takes us up to about 25%, will have a mutation in BRCA1 that's in the tumor, meaning it happened in the tumor, but it wasn't part of an inherited mutation. And then what you see in the blue is another 25%, which now takes us up to 50%, that have this characteristic called homologous recombination deficiency, or HRD. And we're going to talk about that a little bit more when we talk about PARP inhibitors. And then on the right, the 5 figures, 50%, will not have any of these characteristics when it comes to the tumors. And so the BRCA mutations are related, germline and in the tumor only are related, and the homologous recombination is related as well.